All right. Well, good afternoon, everybody. And we are excited that you're here, that you're joining us today. We're having a little bit of difficulty on Facebook, but we are glad that you're here. We will actually record this and then place it on Facebook. And while we have our presenter this morning, we will also make sure that we fix a little glitch that we seem to be having on Facebook this morning. Although it seems to be live, we shall see. So thank you for joining us again for today's webinar about student health services. And we're delighted to have Monica Merriweather from UAB Student Health Services with us today. Will talk to us a bit about what's offered at Student Health Services at UAB, immunization information, and health insurance for your students. So sit back, relax, enjoy your lunch. We can't see you, but we can definitely hear you. If you are on Facebook, which I see is working, again, you can submit your questions through the comment section, and you can also place your questions here via the Q&A. So Monica will take us through a presentation, and at the end, or as questions come up, make sure you place them on the Q&A section, and we will be getting to those at the end. So Monica, thank you for being here with us, and it's all yours.
Thank you for having me, Carmen. Hello, Facebook. How are y'all? My name is Monica with UAB Student Health Services. I am the nurse supervisor here, and I've worked at UAB Student Health for about 13, almost 14 years coming up. So I've enjoyed my time working with college students. They keep me young or they keep me old, but it's a lot of fun either way around. So today I'm going to talk about what our immunization requirements are, our insurance waivers, and whatever questions you guys might have. I'm going to tell you a little bit about our clinic. We're at 1714 9th Avenue South. So we're right like next door to the rec and across from Gold Hall. We're open Monday through Friday, 8 to 5. We're closed on weekends and major holidays. On Fridays, we open at 9, but we still remain open till 5, and we're closed for lunch every day at 12. So your son or daughter can come here if they have a cold, they cut their finger and need sutures, as long as it's in a reasonable time. Hurt their knee, we have a sports medicine clinic. Any gender services, sexual health services. Say they, just want a general physical checkup, mental health, anything like that. We can do it all. IUDs, insertions, colposcopies if need be. We try to do it all. So we are just like any typical doctor's office, and everything. And so we charge insurance and everything like that. We file everything to insurance. So speaking of insurance, there may have been some messaging going to go out about United Healthcare and UAB still doing their contracts. They're still in the midst of that, but nothing is still good until July 31st. But if you have the student health insurance, we'll send out messaging on that. You should not be affected in any way. United Healthcare. So if you have questions about that, we'll send out messaging as soon as we can. Okay. And hopefully everything else will get worked out with the commercial United Healthcare and the UAB contracts. So as far as like your immunizations, if you're an incoming freshman or a transfer student, all students need to have these basic immunizations. Excuse me. 2 measles, mumps, rubella's, or the blood titers for measles, mumps, rubella showing you have immunity. 2 varicella vaccines, or varicella titer showing immunity. Like say you had chicken pox when you were a child, like I had chicken pox, and so I just have my titer drawn that shows that I'm reactive for that, that I have immunity. You need to fill out your TB risk screen. Unless you're born in a country where TB is prevalent, then you'll probably have to do a TB skin test. And then you also need to have an updated Tdap, tetanus, diphtheria, and pertussis. If you have had a Tdap within the last 10 years and it's 10 years old, then you need to have just a regular tetanus and diphtheria, or if you prefer to have another Tdap, that is fine as well. If you're in a clinical program, say I'm not sure everyone who's on this webinar, if their son or daughter is in a clinical program, like they're transferring to go into nursing school clinical requirements or any clinical program requirements require hepatitis B vaccines and the titers, and also to a two-step TB skin test. So those are the basic ones that we need. And of course, oh, and if you're under the age of 22, meningitis vaccine. Meningitis B is not the requirement. It's the meningitis AWCY. It's great to have the meningitis B because I know that's prevalent when you live in dorms and things like that, but it's not required. The other one is required. So if you have questions about that or concerns, feel free to put comments in the chat. I can't see them, but Carmen can. And then also too, if you have questions, feel free to call our office during work hours and we can talk about it further and help give more clarification. So I'm going to show you my UAB Student Health Services top five things to remember. See? Okay, so like I said, UAB Student Health Services is a doctor's office on campus for students of UAB. Students have their own personal health insurance, have the option to waive out of the student health insurance plan. There are no waivers for the summer, but however, waivers for fall opens June 2nd, and the deadline is July 25th. And students who fail to waive, the deadline is September the 15th. And if you don't do your waiver by September the 15th, if you have your private insurance, then you'll be charged the student health plan. And so those waivers are found in BlazerNet. So when you log into BlazerNet, go under links and forms, and then go to the mandatory insurance. So if you haven't registered yet, once you register, the link should pop up so you can do it. But please try to do your best to get that done before September 15th. All immunization records need to be uploaded to the student health portal by August the 1st. August the 1st, because school starts not long after that, and we get a huge influx of records from people on August the 1st that want their records completed by August the 1st, want to be cleared medical clearance by August the 1st, and that's just impossible. So I say the earlier, the better. The earlier, the better, because if you submit something like your blue card or your health department record or from your pediatrician's office or from another school, the earlier you can upload those, the faster we can get to it to let you know, hey, you're missing this Tdap. You know, you need to get a new Tdap, or you need to get a new tetanus diphtheria, or hey, you had your MMR before the age of 1. The first MMR vaccine needs to be after the age of 1. The quicker we get the records, the quicker we can go through them and see what you're missing, or let you know, hey, you don't need anything. You're all cleared. So please, please, please get those in before August the 1st. It's only a few people that do medical clearance here. And so when we have over 20,000 students, it gets to be a lot on those few staff. Okay, and you can also get immunizations done here at Student Health. If you're not able to get in Student Health, you can get them from your doctor's office. You can get them from any pharmacy, anything like that. Just make sure you have the record uploaded of your name, date of birth, what you received with the lot number, and the expiration date and all that information, what arm it was given in, so that way we can make sure it's valid. And then this fall, we will have a Canvas course. So this is great for all new students and all students that are transferring here. This Canvas course it'll include modules of general information on student health, the services we provide, immunization requires, insurance and waivers, and how to navigate the student health portal, and just general explanation of healthcare and insurance. So this is a great thing. Some people have spent a lot of time to try to record it and build it, so that way it's very helpful. So yes, everyone needs to partake in that, because it'll be a great asset to you if you have a question. So we are here, and if you have any questions or any concerns, please feel free to reach out to us at our front desk. And then also too, you can go to our website and get any type of general information that you might need. Our website is www.uab.edu/student health. And that'll take us to your website, and it'll bring us to the portal. And there's different informations about the immunizations you might need, medical clearance questions, insurance questions, just general questions about like what we offer and things like that as well. Carmen, do we have any questions in the chat right now?
Yes, we do have some questions, and one of the questions has to do with, you listed the several immunizations that are required. Are those listed? So I am placing the website for student health services on the chat, so I hope everybody can see it. And I'm also placing a list of frequently asked questions that is on the website for student health services. And there's also a page with information about immunizations that are required. And I believe that depends on whether the student is a clinical student or not non-clinical student. And
Yeah.
there's a short questionnaire that says, what immunizations do I need? And then if you click on that, you will be able to kind of see if your student is clinical, non-clinical, U.S. citizen, non-citizen, and then it kind of gives you a list. Is that correct?
That's correct. Because most 18-year-olds, they're not in their programs yet, so they got time to decide, but they do need those basic ones. And once they get in their program, we know what they need, but their program will also go over, these are what you need. So the helpful thing is that we do, if students already have their hepatitis B vaccines, we go ahead and add those records in the portal. So then by the time they get into nursing school or med school, dental school, or any other clinical program, we can see, yes, they've had those three, they just need the hepatitis B titer.
Right.
So,
And yeah, okay. So,
mm,
and the important thing also is when students submit their immunization record, if there's something missing, if I understand, I remember correctly when my student was a student at UAB, he got a message, you're missing this or something. So it doesn't,
yes.
yeah. Does
So
it,
go ahead, I'm sorry.
no, I'm sorry, go ahead.
So you'll receive a message in the patient portal. If you don't receive anything, and maybe you've gone on your record and say like, hey, it looks like green check marks, so I'm not sure, just give us a call or message us through the patient portal. Okay. We prefer students only, messages through the patient portal, because we can't talk to parents without written consent from the student. And so I've had some I have some parents that have access to the portal. There's nothing wrong with that if everybody is on the same page about it in the family. But it's surprising to me when I get a message say, hey, I'm Anna's mom. She blah, blah, blah. And I'm like, I can't talk to you. I have to call the student and talk to them directly unless we have something written in on their file. So, but we message the patients about what their immunization are missing, say, and we have a template, we have already preemptive information to give out. So, and if you're just messages back and be like, hey, I got this done, say you got your Tdap done at a pharmacy. So there's a place for you to upload that into has an immunization record. And sometimes people can't navigate that very well, and that's fine, but they'll attach the record to the portal message and we can see that as well.
Okay. I have two questions that have to do with TB immunization. So for non-clinical majors, let's say computer science, the TB shot is not required. Or when is it required and when is it not required for students to have the TB shot?
So typically, if it's something that's not required, they fill out a TB risk screening. So they fill that out, and then that lets us know if it's required for them or not. So say someone's international coming from Turkey or anything like that, they are required to have a blood test because we don't accept any TB testing outside the United States. So yes, that student will have to be required. But say someone was born in Colombia where there is maybe a high prevalence of TB and they answered that on their TB risk screen, it's possible they might have to have a TB skin test. So when they fill out the TB screen risk, then that kind of prompts them and lets us know whether they need it or not, and lets them know as well. But if they ever have any questions, then feel free to let us know. We always get a new training on TB, feels like every year. so so we even still have questions ourselves, and we've had to change things a lot even with that. So, but that's the best way. And if anyone's having like a positive TB skin test, our medical clearance coordinator, you can reach out to her. Her name is Taylor Stewart in the patient portal, or myself, and we'd be happy to talk to you about, hey, I've had this positive in the past. Where do I need to go from here? But the
But what,
TB risk screen is where we start.
okay, so just to I guess summarize, families and students should complete the TB risk form,
Mm-hmm.
and then it'll direct them whether they need to have the
Mm-hmm.
test done or not. All right,
Yes.
awesome. And what's a good email for families to reach you at, Monica? I know I have your
Oh,
email.
so in the patient portal, you just messaged me in the patient portal.
Okay.
When you go to inside the patient portal, do new message, and then you can, it should say message to nurse, um, or message someone other than provider, and then you can pull up my name. Our names are in alphabetical order. My name is Monica Merriweather. So,
All right, awesome. Now, just put just for reference, I cannot access the patient portal because I don't have a patient portal access. But if you go on the website for UAB
yeah.
Student Health, the last tab on the right is a patient portal, so your students should
Mm-hmm.
be able to access it that way. Okay, great. So a student has, let's say right now, the student has coverage with Blue Cross Blue Shield,
Mm-hmm.
but it will expire in September. So how can she go ahead and sign up for UAB insurance now to make sure she doesn't lag in coverage or lose coverage for that period? Or what's the best recommendation?
So I would recommend um submitting that waiver, of course. And then if you want to talk about getting on the insurance, because there is a cost. And so everyone, we want everyone to understand like the cost and everything. So the best thing to do if you're in that situation is to call our front desk, and we can help you answer those questions and navigate that. And the cost of the insurance plan is on our website as well.
And I just placed the website for student health insurance. Again, if you go into uab.edu/student/health, it'll take you into the website, and then it'll provide you, there's little circles that give you, for immunizations for insurance. Is that correct, Monica?
That's correct. Let me see if I can pull up the website. I'm going to stop sharing for just a second.
Okay. And in the meantime, while Monica pulls up the website so you can have an idea of what it looks like, again, the links are on the chat side of our presentation. And again, you can always send us an email at families.uab.edu if you have any questions, and we'll send them over to Student Health Services. Also, you can go into the patient portal and request or send a message to Monica. Again, in the meantime, while we wait, if you have any additional questions, and I'm looking sideways because I'm also looking at Facebook, if you have additional questions, this is a great time to ask. We will be sending out additional information through the Family Hub as things progress, and so we'll be sending updates, reminders about what families need to do.
Can you see our website, Carmen?
Yes, so I can,
Okay.
yeah. Mhm.
So here's our homepage. Right here, you have patient portal, insurance. And if you click insurance, it talks about our insurance plan and the cost, um, and what's mandatory and not mandatory, and a plan brochure and what's optional. Because we do have optional plans, because some people, they might have a semester where they don't have the Blue Cross anymore and they need to just have insurance for like a certain amount of time and things like that. So that's why it's best to call our office so you can get those questions asked, okay, and answered. And then here's about the waivers and enrollment. We've got a YouTube video up too, so that's helpful. And so it goes through about the waiver reminder, the system, and that's on YouTube, and that's connected in this website as well. And about the deadlines for summer and spring. for the summer and the fall. And then if you go to about, let's see, you go to get started, it shows our appointments. You can schedule appointments through our web booking system and our no-show policy. And then if you go to health services, here's where you'll find everything on your immunizations page. Like it talks about our mental health, sexual health. We have a registered dietitian. Click on here and go to immunizations and TB tests, and it tells you about when we can get your TB tests and things like that. If you have allergy testing, allergy injections that you need to get, we have an allergy clinic as well, and it goes through that. And then and if you go to get started, immunization clearance is right here. And this talks about our due dates, and how you determine your immunization level. And also too, right here, I'm gonna click on this. This shows an infographic of how to submit your records. And this is very helpful in the past. And it's even helpful for myself that we've changed some things. We were able to do this just 7-step infographic. So if everyone wants to take a screenshot of this, they're totally fine, they can. And that can be found on our website as well. And so these are just about the holes and access to the portal. And if you have any questions or anything like that, I will throw this out there that on our orientation days, the second day, student health, we are here. We are there at the Hill Center. And then we're at the checkout portion. So about 3:40, I think 4 o'clock, you can come to us and we can, if you bring your immunization records, we can help you navigate how to upload them to the patient portal. And then you can ask questions about insurance as well. Usually just take your phone, take a picture, follow that infographic, and then voila, it's there. So it also talks about that we've had a lot of patients that are coming to us that already have diagnosis like but type 1 diabetes. So say your son or daughter has type 1 diabetes and they want us to take care of their care while they're here or be sent out. You can fill out a medical release form and have your doctor's office send us the records, or we can get the records from them. So that way we have everything we need to be able to take care of your son or daughter as well.
So everything again is on the website uab.edu/students/health. So again, remember our website here at UAB are pretty easy. It's uab.edu/ whatever you're looking for, and it should take you to a page where you can find all the information that Monica is showing. And like she said, and thank you for reminding us about that, on the second day of orientation towards the end at around between 3 and 4, Student Health Services is there. If you have additional questions, you can come talk to them, see them. And so just feel free to reach out to them directly, go to the patient through your the patient portal, or send us an email, and we'll be glad to forward it to the appropriate individuals or persons. So again, if you have any additional questions, I'm also looking at Facebook, and I think those who are joining us on Facebook. And if you have any additional questions, this is a great time. We'll have Monica for a few more minutes. One question that does come up often is if there's a hold on my student's account because they're missing maybe an immunization, does that mean they cannot continue going to class, or how does that work?
As far as I know, they can continue going to class. It will probably affect their registration. So registering for the next semester, it will affect that. So, and if you're graduating, you need to have everything done because you don't want that affecting your graduation as well. So, but yes, registering for the next classes you would probably not be able to go further with that. So, and that's when a lot of students realize, hey, we've been sending you portal messages and they haven't been reading them. So your student also needs to realize that the portal message we send them is directly linked to their email. So when they click that, it'll take them to the portal so they can see it. Just like at your doctor's office, if anybody goes to UAB, they have the UAB medicine portal. And so if I get a message from my doctor, it goes directly to my email. So it'll go directly to their uab.edu email. So, and we can tell they didn't read it. So, if you didn't read it and you call us, we're happy to help you. So we know students are busy and things like that as well. So we get it.
And it becomes very important. That's why we encourage students or families to tell their students to check their UAB email, because if there's any messages about a hold or something, they will get it through their email and they can take care of it. Through the Family Hub, you may also get notifications once your student has granted you access. You may get a notification saying there's a hold. You may not know what the hold is about. And so, and if you call us, we won't be able to tell you either, because we don't have access to that information, but we will always tell you, ask your student to check their email. The hold is there, their BlazerNet, and they'll be able to see what it's for.
And
One other,
I'm
yes,
sorry.
go ahead.
And also too, like if you say, "Oh, I've got a hold," just message, and we've messaged you, message us back or give us a call. And sometimes you'll be able to see, like you'll look at your immunizations and medical clearance, you'll say, well, there's an X by Tdap. There's a red by Tdap. It's not green, or things like that. So that kind of gives you indication, hey, let me check this message. They probably sent me something, or this is what I need. So if you're unsure, reach out back to us through the portal or give us a call. So we try to do our best to answer the phone and see patients at the same time. So the portal sometimes is the fastest way for us to respond back.
I have two questions that kind of have related in the same way. Does the student need to be registered for classes in order to be able to submit their insurance information or the insurance waiver? Or can they do it before they're registered for classes?
I think the link does not show up until they're registered. I have to get clarification on that. But I know last year, once the students registered, then the link showed up and they were able to submit everything. So, and or they can try now. And if they have problems, if they have registered and the link is not there, then definitely give us a call and we can help you navigate that. So, you're always welcome to try the link now, but if it's not there, it will pop up once they're registered.
And also, once a student has registered, technically they're very, very official now. So things should move and navigate more smoothly once they're registered. That everything starts, moving along, and all the information will be coming again to their UAB email. So they need to be checking their UAB email. So
there's always technical issues. So if you find, sometimes we don't even know there's technical issues until we get a bunch of phone calls like, hey, this is going on. We're like, okay, we need to know, we need to get this fixed. And then once it's fixed, we're good to go. So just bear that in mind that sometimes that happens. So, but like I said, the earlier you can do things, the better. And if you do have problems, please call us. Okay.
yeah, and I just put also our families at uab.edu email. Again, if sometimes, again, like Monica said, we're the last ones to know because we're not filling out all the information, all the forms you have to do. And if you are our eyes out there. So if you encounter difficulties, and we're hearing this a lot, again, this is what we're here for. We'll make sure that somebody knows that something is not working right. And
Yes.
Again, email us, and you can send us an email at families@uab.edu, and you can email through the patient portal. So you can do it multiple ways, and we'll be here to help you. So
yes, of course,
yes.
that's what we're here to do.
One other question: if the student, because we want students to take ownership of this and be submitting the forms, if a student accidentally submits something incorrectly, is it possible to go back and reset it from your end, or resend it? What would be the best way to go about that?
So if we get something incorrectly, the student can always delete it out themselves. At least they should be. But if we get something incorrectly, we'll 9 times out of 10 say, hey, you accidentally submitted your insurance card, a picture of your insurance card instead of your immunization records. So we can go in and just say, this is what we need and that kind of stuff, and just kind of help the student navigate that, because mistakes happen and they're like, oh, I accidentally, I had someone to accidentally submit their car insurance instead of their immunization records. So if that's the case, we can delete that out and get the right thing in. So you just send us the record. We'll delete the car insurance that you actually sent us, or the dental insurance, or anything else that you might have accidentally sent us. We can delete that out, and that way you can have access to add it back.
If a student is out of state, is it better to just get UAB insurance, or will the out of state insurance cover the student at UAB?
So I would recommend calling your insurance company and seeing if you are in network within our state, and if student health would be in network. We do have some students that might have a federal, like Blue Cross Blue Shield plan. Sometimes I can't tell where they're from in that state until I'm trying to do something with their insurance. So I would recommend always calling your insurance company. We accept TRICARE and as well. And we accept all major medical insurance. So even with TRICARE, sometimes that's from out of state, and we have ways of verifying and everything. So if you feel more comfortable doing that, please give us a call before you purchase anything. If you have out of state insurance, give your insurance a call. And if you still have questions, please call our front desk, and we can have you talk to our insurance coordinator. Right now, we're in between insurance coordinators, but we can get your questions answered.
If a student has dental insurance coverage through do they have to fill out a dental health waiver as well?
So no, the dental insurance is optional. And so if a student wants dental insurance as a supplemental just for dental, that's fine, but it's not required for us. Just medical insurance is mostly required. And if a student wants dental, we have access to information about that if you want to pay for it, like on the side.
Awesome, thank you. And yes, since reminding me of that question about dental insurance, we had a presentation yesterday by UAB Dentistry. So if you have questions about whether your insurance will cover your students if they need to go have dental, care done here at UAB, you also can reach out to them. So our webinar for yesterday's UAB Dentistry is on Facebook, and you can go back and look at it again. So again, I'm monitoring questions on Facebook. I'm not seeing any questions, but we do appreciate everything that you have asked us today and asked Monica, and we appreciate Monica being here with us today. We know this is a lot to navigate as you're transitioning and having to deal with all kinds of forms, but please know that we're all here to help you and help you navigate this. We're here to help your student as they navigate through this. So please reach out to us if you have any questions, and join the rest of our webinars, which will be happening, this week, next week, all the way through August. And if you have any questions, do reach out to your Student Health Services through the patient portal, or email us at families@uab.edu. We do have one.
Carmen,
yes.
And Carmen, I can also email you this top 5.
Okay.
So if anyone has questions, I say please reach out to us. Give us a call. Come see us at orientation if you have questions on the second day. We're there. And also too, if your son or daughter wants to reach out to us through the patient portal about questions, we can answer those as well. So I will actually be out of office for a couple weeks, but there is someone that will be watching my box if you have questions for me, or you can reach out to our medical clearance coordinator, Taylor Stewart, or you can message our insurance. I think we have an insurance box. Either way, someone will be able to answer that question. And if you're like, hey, it's been a couple of days, I haven't gotten a message back, give us a call.
Or email us and we'll give them a call.
Yeah.
We can do that too. So it's a partnership here. We're all here for you. And so know that. So in order to see our webinars, this webinar and all of the webinars we have will be on Facebook for you to watch later, for you to share with other family members, other students who may not have seen it. So the link for our Facebook pages, or the caller is UAB Families. So if you just go to Facebook, type in UAB Families, you should be able to see that. And we also post a lot of information on Facebook. So we do it both ways, through the Family Hub and Facebook and Instagram. So I don't see any more questions, but I do want to thank Monica for being here with us today. We'll actually place the top five, probably as a post for new families so that you can have it with you and check it. And then let us know if we can help you in any way. Thank you, everybody, for joining us today. Thank you, Monica. And we look forward to seeing everybody here for orientation if you still haven't been here, or getting your emails and being able to answer your questions. So have a great rest of your Friday and a wonderful weekend, and have an enjoyable day again today. Thank you, everybody.
Thank you. And we are also on Facebook and Instagram at UAB Student Health as well. So thank you, Carmen. Thank you, everyone that I can't see, but thank you for allowing me to join you all. Bye.